Hey everyone, welcome back to our channel. Today, we're talking about something super important for men's health, and that is PSA. PSA stands for prostate-specific antigen. This protein is made by the prostate gland, a key player in the male reproductive system. The prostate gland has an important job. It produces a fluid that makes up part of semen, which helps to transport sperm out of the body during ejaculation. PSA plays a crucial role in this process by helping to liquefy the semen in the seminal coagulum, which allows the sperm to swim freely. But remember, too much PSA in the blood can be a sign of prostate problems, even cancer. So, if you're a man over a certain age or have risk factors for prostate cancer, understanding the PSA test is crucial for you. Stay with us as we uncover why the PSA test is a vital tool for prostate cancer screening. Don't forget to hit that like button and subscribe for more health tips and insights. Let's get started. First, we discuss why PSA testing is done. Understanding the critical role of early detection in effectively managing and treating cancer, the PSA test has become a widely used tool for screening. This test checks PSA levels through a simple blood test. The main reason we do this test is to monitor the health of your prostate. If your PSA levels are higher, it's like a little red flag waving, suggesting we take a closer look. One significant concern when PSA levels are high is prostate cancer. But don't panic. High PSA levels don't automatically mean you have cancer. Instead, they serve as a heads-up for your doctor to investigate further and ensure everything's okay. This test allows healthcare professionals to identify elevated PSA levels, prompting further investigation and potentially leading to timely diagnosis and treatment. So, in simple terms, PSA testing helps us catch potential prostate problems early, like cancer, so we can take action. It provides a sneak peek into your prostate health, giving you the chance to act if needed. Remember, it's always a good idea to discuss with your doctor whether PSA testing is good for you based on your age, family history, and health history. You should consider PSA testing. Now let's talk about who should consider PSA testing for prostate cancer. First off, it's important to know that PSA testing isn't necessary for everyone. But if you're a man over 50 or at higher risk for prostate cancer, it's worth considering. So, who's at higher risk? Well, if you're a black man or have a family history of prostate cancer, you're at higher risk. Additionally, if you have a genetic mutation like BRCA2, you're also at a higher risk. Now, let's talk about age. The recommended age for PSA testing varies depending on your risk factors. For most men, testing starts at age 55. However, if you're at higher risk, as I mentioned earlier, you might want to start testing earlier. Some experts recommend starting at age 40 for black men or those with a family history of prostate cancer. But remember, PSA testing isn't a one-size-fits-all solution. It's a personal decision that you should make with your doctor based on your risk factors and personal preferences. So, if you're a man over 50 or at higher risk for prostate cancer, consider talking to your doctor about PSA testing. It might be a helpful tool for you. Always remember that it's not necessary for everyone, and it's important to make an informed decision based on your unique situation. How is the PSA test performed? Now, let's discuss how the PSA test performed. It's simple and nothing to stress about. It's just a regular blood test. They'll take a small amount of blood from your arm, usually from a vein near your elbow. This blood sample is sent to a lab where they measure your PSA levels to see if they're in the normal range or elevated. Some of you might be worrying, is it going to hurt? Well, the good news is it's quick and not too painful. It's more like any other blood test you might have had before. You'll feel a little pinch when they insert the needle, but the discomfort is minimal and it's over before you know it. Plus, this process usually takes just a few minutes, so you'll be in and out in no time. In short, the PSA test is a simple blood test where they take a small sample from your arm to check your PSA levels. It's quick, relatively painless, and a necessary step in keeping an eye on your prostate health. So, if you're due for a PSA test, Don't put it off, it's a quick and easy way to stay on top of your health. Interpreting PSA test results. Let's discuss what your PSA test results might indicate. First, it's crucial to understand that a high PSA level doesn't always indicate cancer. Many factors can elevate PSA levels. According to Halo Precision Diagnostics, PSA levels between 0 and 2.5 nanograms per milliliter. If your PSA levels are between 0 and 2.5 nanograms per milliliter, prostate cancer is not likely, and there is a low chance that you would require further testing. PSA level between 2.5 and 4.0 nanograms per milliliter. A PSA level between 2.5 and 4.0 nanograms per milliliter is generally considered normal. In the absence of other risk factors, if your PSA levels aren't fluctuating, and if you aren't taking medication for BPH, your doctor may decide that no additional testing is needed until your next annual physical. PSA levels over 4.0 nanograms per milliliter. If your PSA levels are over 4.0 nanograms per milliliter, or if they are rising, your doctor may wish to order additional testing to rule out other conditions. For example, a urine test might help check for a urinary tract infection. Although PSA levels between 4.0 and 10.0 are considered suspicious, there is only a 25% chance that you have prostate cancer. PSA levels of 10 nanograms per milliliter or higher. If your PSA levels are 10 nanograms per milliliter or higher, these levels are considered dangerous. This means your chances of having prostate cancer are 50%. In short, a PSA level below 4.0 nanograms per milliliter is generally regular. A level between 4 and 10 nanograms per milliliter is considered a borderline or gray zone, indicating a higher risk but not a definitive diagnosis. Elevated PSA levels don't always point to cancer. Other factors, such as prostate inflammation or an enlarged prostate, can also raise PSA levels. Sometimes, a high PSA level can be regular, particularly as you age. If your PSA level is elevated, consult your doctor about the results and potential next steps. They may recommend further tests, like a biopsy, to check for cancer. Keep in mind that an elevated PSA level is just one factor in diagnosing prostate cancer. Don't panic if your PSA level is high. Discuss your options with your doctor and create a plan together. Benefits and limitations of PSA testing. Now let's break down the pros and cons of PSA testing. First up, the benefits. Early detection. The main advantage of PSA testing is catching prostate cancer early. This early detection can lead to better treatment options and outcomes, increasing your chances of beating the cancer. Prostate health monitoring. Regular PSA testing allows you and your doctor to monitor changes in PSA levels over time. This ongoing monitoring provides valuable insights into your prostate health and can help detect any abnormalities early on. Peace of mind. For many men, knowing their PSA levels are normal can provide reassurance and peace of mind about their prostate health. Limitations. There are some limitations to consider. False positives. Occasionally, PSA levels can be elevated even when no cancer is present. This can lead to unnecessary worry, anxiety, and additional tests or procedures that may not be needed. False negatives. Conversely, PSA levels can be normal even if prostate cancer is present. This can provide a false sense of security, delaying necessary treatment and potentially allowing the cancer to progress. Overdiagnosis. PSA testing can identify small prostate cancers that may not pose any harm during a man's lifetime. Detecting these insignificant cancers can lead to unnecessary treatments with potential side effects. Potential for unnecessary treatments. If a PSA test suggests a problem, you may end up undergoing biopsies, surgeries, or other treatments that you may not need. So, while PSA testing offers the benefit of early detection and monitoring, it's not without limitations. There can be false alarms and potential for unnecessary treatments. and it might not catch all prostate cancers. It's essential to weigh the pros and cons and have an open discussion with your doctor to decide if PSA testing is the right choice for you based on your circumstances, age, risk factors, and overall health. Conclusion. Let's wrap things up. Today, we've talked about the PSA test, a simple blood test that assesses the health of your prostate. The upside: PSA testing can be a valuable tool for early detection. By identifying potential prostate issues early on, you can receive prompt and effective treatment, leading to better health outcomes. The downsides: however, PSA testing is not foolproof. It can sometimes produce false positives or false negatives, where the test results may indicate a problem when there isn't one or miss a problem that does exist. There's also the risk of overdiagnosis, which can lead to unnecessary treatments. You should consider PSA testing if you're a man aged 50 or older, or if you have a family history of prostate issues. It's worth discussing PSA testing with your doctor. They can help you determine if it's the right choice for you based on your age, overall health, and other factors. Always remember, it's super important to take care of your health. So, stay informed, ask questions, and consult with a healthcare professional to make the best decisions for you. If you want to learn more about PSA testing and prostate health, I've included links to reliable sources in the description below. Feel free to check them out for further reading or to connect with a healthcare professional. Remember, knowledge is power when it comes to your health, so keep learning and stay proactive about your well-being. If you found this video helpful and you want to stay in the loop with more easy-to-understand health tips, make sure to hit that like button, share it with your friends and family, and don't forget to subscribe to the channel. Thanks for watching, and I'll see you in the next video.